They gave me 25 minutes with the president of Finland. And she was very good to me. She sat there and gave me time. But at that time, I had not developed this language. And I was like, now, so what do I tell this president? Should I say abstain, be faithful? And it is from that encounter that I came back and I said, no, I think we need a message that can address leaders like you, like me. What are you doing to reduce stigma, shame, denial, discrimination, and misaction? Mr. President or Madam President, what are you doing to promote safe practices, to promote access to treatment and nutrition, to promote and multiply testing and counseling, or to increase the empowerment of people who are vulnerable to this epidemic? What policies do you have? What budgets do you have? So that if they give you 5 minutes, you have already talked to the president. Can I know how much money you have committed to reducing SIDM? And may I know how much money you have committed to multiplying SAVE? And then he would say, what is SIDM and what is SAVE? And then you would have a chance to discuss and say, you cannot defeat AIDS unless you have a deliberate policy, a deliberate strategy to reduce stigma, shame, denial, discrimination, inaction, and misaction on one hand, and to increase safe practices, the abstinence, the faithfulness, the mother-child, the condoms, the safe blood, safe circumcision. We know them, these things. Access to treatment and nutrition, testing and counseling, and empowerment especially for women, for men, for young people, for children, and for families and communities living with HIV. So, Mr. Moderator, for me, to summarize and end, I think that you are talking about strategic leadership and partnership. I think we need to come out of this room, if it is the will of these leaders, that we need 5 points on which we can hold each other accountable. 5 points, not many. Number 1, reducing stigma and discrimination and those twin evils of misaction and inaction. That's number 1. Number 2, multiplying safe practices in our communities, in our families, in our mosques, in our temples, in our churches. Number 3, increasing access to treatment and to nutrition. And we know treatment, what it does. The post-exposure prophylaxis, the opportunistic infections treatment, the ARVs, and so forth. We know. Number 4, increasing testing and counseling. There shouldn't be someone who is HIV serostatus blind. That's something that puts me and say, are we defeating the virus or not? Meet someone and ask, have you tested for HIV? No. Have you abstained from sex? No. You forget I'm married. So, if you have not tested and you have not stopped having sex because you are married, is there any way you have changed your sex life so that you reduce the risk to pass on or to get the virus? Don't talk about those things, they are not nice, my church doesn't support them, then you are saying, surely, if we have 1 million people thinking like this one, then we are losing the fight. So we need to increase our messages. On day number 5 would be the empowerment message. What budgets, what strategies. So UNAIDS helped us to give us the 3 key issues which we think could be very important. We can strengthen those. UNAIDS helped countries to have one coordinating entity on HIV. This summit could say one coordinating entity on what? On reducing SIDM and multiplying SAVE. UNAIDS said you should have one M&E framework. This summit could say on what? One M&E on reducing SIDM and multiplying SAVE. UNAIDS said countries should have one country plan. Plan on what? Because they can decide and put all the money on condom purchasing, and then they forget that there is mother-to-child prevention, there is a safe circumcision increment. So you also need to hold them accountable. You have a plan, but does it address stigma reduction, and does it address safe practices, access to treatment, testing and counseling, and empowerment? Why don't I sit down, Mr. Moderator?